Hello everyone, my name is Mina Massaro-Giordano. I'm a professor of ophthalmology at NYU Langone Health. I'm delighted to be here at ARVO to discuss our interesting work that I've done with my fellow Julia, who will go into the details of the work. But why is this work important? Well, we know dry eye is a big problem, it's very prevalent, and we know from the DEWS classification that neurosensory abnormalities play a role in dry eye. So we're here to see what do the corneal nerves actually look like. And for many years we've used confocal microscopy. But as some of you may know, it's difficult to obtain this piece of machinery. So we have at NYU acquired a sophisticated piece of equipment, which is a CCC, and it's looking at wide field specular microscopy to look at the subbasal plexus in these patients with all types of dry eye. And I will have Julia here, my fellow, who's done some incredible work, describe the details of the trial.
My name is Julia. As Dr. Massaro said, I am the clinical research fellow at NYU currently, and been working on this project with the dry eye study with the CellCheck C device, which is a CCC, and we have been able to take video images of the corneal nerves, which has been very exciting. And after taking those images and videos, we're able to look back and trace them using CC metrics to be able to obtain the corneal nerve fiber length and fiber density, and we have been able to find a statistically significant correlation, which is very exciting since we no longer have the in vivo confocal to use at NYU. So we were able to image 225 eyes and analyze those images, and we were able to find that the corneal nerve fiber length was significantly less in dry eye patients at all 4 clock hours, as well as the inferior whorl, and we found that the inferior whorl was much more prevalent in the healthy controls compared to the dry eye cohort as well. This is significant because a lot of dry eye work and treatment right now focuses on regrowing those corneal nerves, and it's how a lot of doctors like Dr. Massaro is able to determine the next route for patient care.
As far as patient care, this just allows us another modality to help us diagnose dry eye and follow their progression. So this is why it's important, and because the technology out there is constantly changing, and right now we don't have the in vivo confocal microscope that's available, we need another option. So that's why this is important, to help diagnose and also help to follow progression and also see if treatments are effective for these dry eye patients.